I started out as a parent educator with ECAC a little over 2.5 years ago, and recently moved into the position of a co-director on the North Carolina DeafBlind project. And I myself am a mom of 4 boys, the youngest of which is medically complex and on the North Carolina DeafBlind census. And this is my colleague, Nancy Giurato.
Hello, everyone, and good afternoon. My name is Nancy Giurato, and I have been with ECAC for about 2 years. I'm a parent educator. I'm also serve as a family engagement coordinator for the North Carolina DeafBlind project. I am a medical mom. I have 2 kids with special healthcare needs, ages 8 and 6. My eldest has autism, and my youngest has vision and hearing loss. And so here we go.
Thanks. So today we'll be going over some statewide resources for the deafblind population as well as medically complex population. These two populations tend to overlap quite a bit. And while maybe not every one of these resources will apply to you or the families that you serve, I'm almost certain that something in this presentation will be applicable to you. I will go ahead and start by telling you a little bit about the North Carolina DeafBlind Project. I know many of you who are here may already know some about us, but in case you don't, the North Carolina DeafBlind Project is a federally funded grant through the Office of Special Education Programs, or OSEP, and it is administered through the North Carolina Department of Public Instruction, NCDPI, in the Office of Exceptional Children. The mission of NCDPI and the North Carolina DeafBlind Project is to assist educators, related service providers, and families to gain knowledge to enable children who are deafblind to access the general curriculum and gain skills and experiences that prepare them to successfully transition into adult life. The North Carolina Department of Public Instruction, in collaboration with Eastern Carolina University and ECAC, or the Exceptional Children's Assistance Center, directs grants activities such as this, these webinars, and also other educational trainings for families. Nancy?
Yes, so since the North Carolina DeafBlind Project is federally funded from the Office of Special Education Programs, we have to read this disclaimer. The contents of this presentation were developed under a grant from the U.S. Department of Education and the grant number. However, those contents do not necessarily represent the policy of the United States Department of Education, and you should not assume endorsement by the federal government. Thank you, and I'll pass it on to Brittany.
Thanks. So I'll start just by telling you a little bit about ECAC. If any of you have never used any of our services before, ECAC is the Exceptional Children's Assistance Center. We're a nonprofit organization dedicated to improving the lives of children and families in North Carolina, with a focus on those with special healthcare needs or disabilities or developmental concerns, ages birth through 26. We provide individualized one-on-one assistance, resources, education, and trainings to families. We also serve youth and professionals with a variety of topics that relate back to special education, health information, and community engagement. We also provide leadership opportunities as well as getting you in touch with other leadership opportunities across the state. Our organization is for families and by families. Okay, so we will be moving a little bit fast today since there's a lot to cover. Please know I will be sending out a follow-up email to all the participants that'll include a PDF version of the slide deck along with clickable links, as well as a link to access this recording, which is going to be posted on ECAC's YouTube page. So please be on the lookout for that. And I just want to let you know that, there is a purpose behind the resources that we're sharing today. And while we know that maybe not all of these will apply to you, we're hoping that you will find something of value here. And I'm almost certain that you will. We have a lot to share with you. Families can definitely benefit directly from these organizations. Family leaders are often passionate about helping other families navigate systems and find support. So everything that we share with you can also be shared further with other families and professionals alike. All types of professionals who touch the lives of children with special needs and disabilities can use this information and share it. And just so you know, this information is not all inclusive as much as we wish that it was. I know that there is so much more out there. And just so that everybody knows, we're always updating this presentation. It's constantly evolving. So if there's anything out there that you wish for us to add, Nancy and I would both love to hear about it. Okay. So we'll start by talking about Advocates for Medically Fragile Kids, NC. This is a nonprofit organization that serves to educate families and professionals alike about the nuances of the medical waivers and also accessing resources across the state. They work with legislators and other policymakers to ensure that the family voice is heard too. And so while educating families, they get the information into their hands and then help them figure out what next steps are to do that and to further their own advocacy. I included a link to their website because they recently updated their website to provide a more user-friendly look that has actually been really helpful to a lot of the families that we serve. One thing that I like the most about this website specifically is the breakdown of the Medicaid waiver programs. If there's anybody out there that needs help with the nuance of that and navigating it, this website might be a good place to look. So we have A Kid Again, the Central Carolinas chapter. At A Kid Again in the Central Carolinas chapter, this is a charity-based organization in Charlotte, North Carolina, who serves families raising children with life-threatening conditions across North Carolina and also South Carolina. Let's see. Next up, we have the ARC of North Carolina. The ARC has multiple chapters in different locations across the state, and the ARC has programs and services that could differ by region, but overall they tend to include advocacy, care management, housing, transition work programs, supported employment, guardianship programs, and a lot more. One of the things that I have found most helpful with the ARC is helping around the transition to adulthood and educating families on what some helpful next steps might be that they may have not thought of before. I know the conversation around, things like guardianship, power of attorney, and those types of things can be rather nuanced and really specific. So I have known the ARC to be helpful for that type of thing. I think I'm going to go ahead and pass it over to Nancy so she can tell you more about the Autism Society.
Yes, so let's start with the Autism Society of North Carolina. Like the ARC, they also have local chapters across the state. They have a strong presence in social media, and you can also meet with a referral specialist in person. Among the services they offer, they provide clinical services, respite care, employment support, social recreation. They also provide a lot of webinars and engagement with their toolkits and their blogs and conferences and training for professionals. They are a great ally if you have a child that has autism and you're looking for support at the school level, at the community level, and beyond. And the next one, please. Beginnings. Beginnings is a nonprofit organization that for parents of children who are deaf and hard of hearing. This nonprofit organization helps parents and families understand hearing loss, as well as the diverse needs of children who are deaf or hard of hearing. I have personally worked with beginnings in getting assistance to understand what resources are out there in the state. Also, they have a parent grant that you can apply. So if you want to learn some more, here is the website. Next, please. The next one is CAPC. CAPC is a North Carolina Medicaid Home and Community-Based Services, abbreviated as HCBS. It is a waiver program that provides specialized services and supports to medically complex or fragile children so they can be safely cared for in their home instead of a hospital or institution. And currently, as we know, so far there is not a waiting list for those who qualify for this waiver. And in order to apply, there is a referral process. And for more information, please look at the website. Next, please. The next one I'm going to rush through is Carolina Children's Community Disorders Program Grant. This grant funds hearing aids and other hearing devices for children with hearing loss in North Carolina. Children enrolled in the financial assistance program must be a North Carolina resident and be under the age of 21. So this is a great grant program for those who perhaps have exhausted their other means of getting a replacement of a hearing aid that they have lost. So there's here an additional resource that you can use if that applies to you. And let's go to the next one, please. The next resource is Disability Resource Center. They're a nonprofit and they provide a rate of independent living services to people of all ages with all types of disabilities. The Resource Center employs and serves individuals with all disabilities, especially in the counties of New Hanover, Brunswick, Pender, Onslow, and Columbus County. So if you live in these counties, please pay attention to this important resource. And I pass it back to Brittany.
Okay, thank you. Thank you, Nancy. So many of us might know about Disability Rights North Carolina. This is a legal advocacy agency that fights for the rights of people with disabilities in North Carolina. Disability Rights NC handles cases involving discrimination, abuse, or other rights violations. All of their services are at no cost to families. So we always let families know about disability rights if they're facing something that might lean more towards the legality or they need that type of support. If you've ever heard of Dream on 3, Dream on 3 makes dreams become a reality by using sports-themed dreams for kids and young adults ages 5 through 21 who live with life-altering conditions and some with those mental health challenges and maybe even intellectual disabilities. Dream recipients are given the opportunity to live out their ultimate sports dreams through customized experience with a favorite athlete, sporting event, or sports team. And I think we do have some of our staff with ECAC whose families have actually gotten to have this wonderful experience with Dream on 3. Another resource that we often refer families to when they're going down the path and needing more legal type assistance is Duke Children's Law Clinic. They provide free legal advice, advocacy, and legal representation to low income and at-risk children in cases involving special education, school discipline, and children's disability benefits. I see here below that it says their service area is the counties that are listed: Alamance, Caswell, Chatham, Durham, Granville, Franklin, Orange, Person, Vance, Wake, and Warren. I do know that Duke Children's Law Clinic specifically has an interest in systemic cases. So if there is anything that is a little bit bigger, and also and with that in mind, they have been known to serve counties that are outside of this range as well on a case-by-case basis. So if you need this type of support, please don't be dissuaded from reaching out to them. However, I do believe this is their focus area. One of the most helpful resources that the Duke Children's Law Clinic has put out is a parent's guide to special education. It is a reader-friendly, comprehensive guide that's for parents, so the reading level has been taken into consideration, and they take North Carolina policy and turn it into something that is so reflective of policy, but it's just in a more user-friendly and understandable language. I like to use this resource frequently and also use the Control F feature to find what I'm looking for in there. You can access this resource by going to their website. If you haven't heard of the Exceptional Family Member Program, this resource is quite similar to the services that ECAC can provide, but it is specific for those of us whose families might be in the military. So they provide military families who have special needs children, the considerations during the assignment process, and access to support services to help navigate the medical and educational system. With military families, moving is usually a big part of their life, and sometimes they move frequently. So EFMP services are available throughout the nation, and they are services that are specific to North Carolina as well. There are a couple more links for this than the other resources that we have. So if this is of interest to you, please check out the links provided. ECAC oftentimes works closely with the Family Support Network of North Carolina. A lot of our priorities overlap with supporting families and helping them become stronger advocates for their children. The Family Support Network specifically works to enhance the lives of children who have disabilities, mental health challenges, or special health care needs by providing parent-to-parent support, education, and caring connections to their families. They are regional, so by accessing the link, you'll be able to see which region you're in. I don't know how many there are across the state, but there's quite a few. They do have a map and a directory on their website. One of the really helpful resources that we wanted to highlight about Family Support Network of North Carolina is their summer camp directory. I know that we don't need that resource right now, but as it starts getting closer to planning for a summer break, they do release an updated directory yearly for summer camp options across the state of North Carolina. Okay, I'm going to hand it back over to Nancy.
Hello again. Let's continue with more resources. This time the turn for Family Support Program at the UNC School of Social Work. They provide support for families with children who have special needs and disabilities in North Carolina, and their services include information and referral, education and training, model program implementation and development, consultation and technical assistance, research and program development, and policy development. Next, please. Our next resource is FIRST Resource Center. They connect people with disability and their families with resources they need to thrive in the community. In particular, they can act as an advocate to connect them or coordinating with government agencies, school, or community partners by becoming their effective advocate and advocating on their behalf. And it's important to know that their focus is serving families in Western North Carolina. Next, please. The next one is called First in Families of North Carolina, and here's a website. They also operate in chapters, and they are based what they do is that they are catalysts for individuals and families in North Carolina to meet self-determined wellness goals by leveraging relationships and resources, encouraging reciprocity in their communities. They oversee as entity 14 regional First in Family chapters. So if you're interested in knowing what's available locally to you, please, I encourage you to go to their website and find the local chapter. And next, please. The next one is Foster Family Alliance of North Carolina. They are a nonprofit organization. They are started by current foster parents who know what it's like navigating the system firsthand. In order to prevent parental burnout or turnover, they're changing how to foster, kinship, and adoptive families get access to vital information and resources. So if you're a foster family, please look at this important resource. The next one is Gigi's Playhouse, which is physically located in Raleigh and Charlotte. Gigi's Playhouse it welcomes everybody of all ages. They have an uplifting environment. It's a playhouse in Raleigh that will empower those with Down syndrome and their families. They reach their higher potential by providing programs that are custom and research-based, also curriculums that works toward advancing literacy, math skills, growth, and fine motor skills for those who are having a Down syndrome in particular. And all the resources and programs are free of charge. So that's a very important asset for them. So please check them out if that applies to you. And the next one is Pieta Research Center, HOPE. The HOPE Pieta Research Center is a project of the Family Support Network that Brittany just talked to you about, and it's federally funded community parent resource center, providing information, support, and training for families who have children of all ages with all types of special needs in some specific counties: Alexander, Burke, Caldwell, Cutshaw, McDowell, and Lincoln counties. If you live in these counties, then this may be an additional resource for you. And next one, please.
Well, thank you, Nancy. And I just wanted to mention that HOPE, along with FIRST, I believe, is listed as one of the community parent resource centers, which means that they receive an additional amount of funding from the federal government to carry out some of the work similar to what ECAC can do. So those are the two CPRCs that we have highlighted. And so just to know that they do, this one in particular does work with the Family Support Network as well as working as a CPRC. Okay, so we wanted to go ahead and share some information with you about the Division of Services for the Deaf and Hard of Hearing through the North Carolina Department of Health and Human Services. The next couple of slides that I will share are all services provided by DHHS, and we'll be starting with this one, the Division of Services for the Deaf and Hard of Hearing. They work to ensure that all deaf and hard of hearing or deafblind North Carolinians have the ability to communicate and communicate their needs to receive information easily and effectively in all aspects of their life, especially in their health and well-being. And by clicking on the link, you will be able to see that there are a variety of resources that the Division of Services for the Deaf and Hard of Hearing can support you with. One thing that I like to note about their services is that they provide a ASL translator directory, so that if you need that type of support or are looking for somebody who can translate for you, you may access their directory. They also can support finding those types of services to go with you to medical appointments if necessary. I included a small picture here of their regional centers. They do have a directory by clicking on the link, and the following services will also be following the same map of the regional centers, starting with the Division of Services for the Blind, similarly to the Division of Services for the Deaf and Hard of Hearing, but for the population experiencing blindness or any variation of that. They provide services to people who are visually impaired, blind, and or deafblind, helping them to reach their goals of independence and employment. But in the meantime, and even later in life, they also provide a service called the Medical Eye Care Program, which delivers preventative and corrective services and may also offer the following services depending on the availability of funds, which I will say, to my understanding, the funds are there at this time. So if you know somebody who is a resident of North Carolina and needs eye surgery treatment, may possibly need assistance with accessing medications related to their vision, please do reach out to the Division of Services for the Blind and get in touch with a social worker for the blind. More information can be found by following this link. And interestingly, while looking up the services for the deafblind population, it was noted that there is information on the Division of Services for the Deaf and Hard of Hearing, as well as a different website listed on the Division of Services for the Blind. So please note that these two links included are two different links that may have more information. So by reaching out to the Division of Services for the Deaf and Hard of Hearing or the Division of Services for the Blind, you may be able to access supports for deafblind services as well. In order to do that, you must have combined vision and hearing loss. And some services that are provided are specialized training in Braille, safe travel, adaptive technology, low vision aids can be provided, amplified and tactile devices, training and communication skills, and then on the job training, training on how to keep a job is available as well. And then another one of the services provided through the deafblind services is the I Can Connect program. I Can Connect does provide free equipment and training for people with both a significant hearing and vision loss, who meet the program's disability and income eligibility requirements. So keep in mind there is an income eligibility requirement, but from what I was reading, it seems to be that the threshold is relatively high. So I don't want that to discourage anybody from checking out this resource if you need this type of service. I Can Connect is a national program that does have local offices that helps people stay connected with friends and family around the world through communication devices and support with that.
Staying connected can be a challenge for people with both significant hearing and vision loss. I Can Connect provides free equipment and training to help people increase independence and keep in touch with their family, friends, and community. There are many types of equipment and software options for distance communications, but they can be costly and challenging to learn. I Can Connect puts these life-changing tools in people's hands and provides training to improve the ease of use of computers, smartphones, tablets, braille displays, and other technology solutions. I Can Connect is proud to help people connect with the world around them in new ways. Learn more today or find your local contact at icanconnect.org or call 800-825-4595.
Okay, I'm going to pass it over to Nancy so that she can tell you a little more about the innovations waiver. Nancy, I think you might be muted.
Thank you. I'm so sorry. So let's talk about the innovations waiver. The innovations waiver is a Medicaid waiver, also known as 1915C Medicaid Home and Community-Based Services. This waiver is designed to meet the needs of individuals with intellectual or developmental disabilities, also known as IDD, who prefer to get long-term care services and supports in their home or community rather than in an institutional setting. There is a referral process in order to get into the innovations waiver, and the application also involves contacting the local management care organization. And we have here a link where you can identify who is the managed care organization that serves your county, and based on county and managed care organization, there is a different set of requirements in order to be eligible to apply for this waiver. Also important to know with the innovations waiver is that there is a waiting list due to the many people that qualify and not enough full slots available. The list is called the Registry of Unmet Needs, and the amount of time goes by years. And depending on the county that you live again, that waiting list or the waiting time may be longer or less. It's my understanding that it goes between 1 year for small rural counties to 15 plus years for highly populated counties. So if you like to learn more information about what is specific to your case, please contact your managed care organization. Next. So now I'm going to talk about Legal Aid of North Carolina, which is a great collaborator with ECAC. This Legal Aid of North Carolina has legal advocates that help every North Carolina resident, but especially those that are in deep poverty, to access government assistance, healthcare, housing, and self-employment. Also, they look into questions in the education system as well. Some of the projects include the Immigrant Project, Disaster Relief, Domestic Violence Prevention, Fair Housing Project, Medicaid Appeals, Technical Team, and a Right to Education Project. So if you have any of those questions that you think will be best addressed with a legal advocate, this is one of the resources you want to look at. Next, please. The next resource is the Lifespan Respite Project. This is a program which is an application-based program that reimburses eligible families, caregivers for up to $500 in a calendar year. You can use, if you become a recipient of this award, you can use this amount of money to hire a respite person that can provide that service to your children while you can take some time off. So it's a little bit of relief for those who are looking for a respite opportunity. This is one. The application is not open throughout the year as funds are available. So please go to the website if you're interested and know if they're accepting applications at this time. Next, please. Now let's talk about the Mental Health America of Central Carolinas. They serve especially Mecklenburg and Cabarrus counties. They have a parent voice program support for parents and caregivers of youth with emotional, behavioral, or mental health concerns. They also have a team of support specialists who work closely with families who are navigating the education, the child welfare, mental health, and juvenile justice system. So if this applies to you, I really recommend to look at this resource in more detail. And again, we have the link to their website in here. And let's go with the next one. The next one is the Miracle League. The Miracle League provides opportunities for children with disabilities who would like to play in the Miracle League baseball. And that's particularly a great resource for those children with disabilities, because they include children with all abilities. They promote community support and sponsorship of Miracle Leagues. And if you would like to learn a little bit more, if your child is interested in this, please don't forget to look at this resource. And the next one, I'll pass it back to Brittany.
Thank you, Nancy. So the National Alliance on Mental Illness offers mental health education as well as support groups, some presentations, and resource directory. They actually have some upcoming events as well. The mission of NAMI North Carolina is to provide support, education, advocacy, and raising public awareness so that all affected by mental illness can build better lives. Next up, we have our NC Care 360, which is a very robust statewide resource directory. So this will apply to anybody in the state of North Carolina. This is supported by a dedicated resource team At NC 211, how many of you have heard of or dialed 211 before? So 211 works behind NC Care 360, and they regularly verify and update the programs and services in their directory. So that information should be up to date. This is like kind of the online version of 211, if you will. So you can work with a team of dedicated navigators with the expertise to support what complex needs you might have. They can provide referrals and community based resources. And the interesting thing about NC Care's 360 is that their navigation team can actually stay up to date with you and stay with you through the process. So if you go through referrals or they point you in a direction and things don't work out, you can always come back to their team and they can stay alongside you through that process until you find the resources that you're looking for. So we have NC Child, which is the voice for North Carolina's children. NC Child works to eliminate barriers that stand in kids' way. They advance public policies to ensure that every child in North Carolina has the opportunity to thrive, whatever their race, ethnicity, or place of birth is. Some of their priority areas include quality early childhood education, healthy children, nurturing homes and communities, and family economic safety. Resources and information that we use at ECAC include weekly child advocacy updates, their publications, blogs, and data on their website. They offer training and webinars, including an advocacy one-on-one and effective meetings with elected leaders. So one interesting resource that they offer and some of the services that they can provide is helping families become more educated on how to advocate at a policy level. Okay, so we have the fetal alcohol spectrum disorder informed group that assists caregivers, educators, and professionals from all disciplines to understand the impact and exposure of alcohol in utero, which results in a variety of developmental disability diagnosis, collectively referred to as the fetal alcohol spectrum disorder. This organization provides training and information to caregivers and to a variety of professionals who serve this population, and they can provide information on topics around FASD, interventions, what some interventions might be like, help access SSI, and information regarding transition to adulthood for this specific population. Which brings me actually to a good place with NC START. NC START stands for Systemic Therapeutic Assessment, Resources, and Treatment. The START program provides prevention and intervention services to individuals who may have intellectual or developmental disabilities and or complex behavioral needs. And they do that by providing crisis response, training, consultation, and education. They serve individuals age 6 and up. Referrals for ages 6 through 20 are made through the local MCO. And Nancy had mentioned the Managed Care Organization, or MCO, earlier. There is a directory that we will be sharing with you so that everybody will know who your local MCO is. And by reaching out to your local MCO, you can ask for NC START services. Referrals for those age 21 and older can be made directly to NC START. We're focusing on the younger ones today, but this can also apply to the adult population. It doesn't matter what type of insurance that you have here, or if you don't have any insurance at all, there is no out-of-pocket costs for families to receive these services. Okay, I'll hand it back over to Nancy for a bit.
I'm going to talk about No Boundaries, which is an in-home CAT-C case management and medical equipment loan closet. They are physically located in Haywood County. They serve everybody in the state, and then mainly eligibility is anyone who cannot afford to purchase or rent medical equipment and supplies, individuals whose insurance does not cover the equipment or supplies, or they need equipment for a short term, such as after surgery or a hospital stay. And some examples of what they can provide is wheelchairs, knee scooters, Hoyer lifts, hospital beds, shower chairs and benches, crutches, canes, walkers, bedside commodes, raised toilet seats, and sliding boards and more. So if you're looking for a medical equipment, this will be a good resource for you, and the website is here. Next, please. Next one is the North Carolina Council on Developmental Disabilities, or NCCDD. They are dedicated to empower people with intellectual or other developmental disabilities, also known as IDD, and they by supporting self-advocacy, independence, and the right to self-determination. Some of the programs they have is the Ability Leadership Project, which is a leadership development education for self-advocates, parents, professionals, and other stakeholders. The other project they have is the Jean Wolfe Rossi Fund for Participant Involvement, where individuals with IDD and their family members can receive reimbursement for specific expenses for seminars and conferences designed to improve their knowledge. And for more information, we will provide you the link. Next one. The next one is North Carolina Families United. This is a statewide family network and the state chapter of the National Federation of Families. NC Families United is a family support and advocacy organization for children and youth with mental health or intellectual and developmental diagnoses. They offer rehabilitation for empowerment, natural supports, education, and work, abbreviated as RENEW program. They also offer transition mentoring services for young adults ages 14 to 26. And they also have a statewide chapter of youth called MOVE of North Carolina Families United that promotes involvement of young adults through the state by assisting young adults and agency partners with bringing youth leadership development to their area. And if you want to learn some more, we have the website here as well. Next one, please. And see here. This is one of my personal favorite resources. This is a program for those who are at risk of losing or cannot use a private health insurance because they have a high-risk illness and cannot pay their premiums. You may qualify to have NCHIP pay for the premium services by looking at eligibility criteria. In general, to be eligible, the person has to be eligible for Medicaid and have a private health insurance through their employer or COBRA. For more information, if you qualify, if you're interested to learn more about this program, please go to the link here. And the next one is North Carolina Navigating Care, or NCNC. This is a fantastic online resource and tool for families who are looking for some help with navigation of resources. That is also tailored for professionals. It is designed to assist families who have children who with or at risk for developmental delay or disabilities, answer common questions, and find resources. So if you want place or resource, a tool that can help you find many answers to the multiple questions you might have, this may be a good resource or starting good resource for you. And the next one is the NCSEAA that probably if you have been attending webinars with ECAC, you have heard about this before. That's the North Carolina State Education Assistance Authority program. Under this program, there are two educational scholarships available. One's called the Opportunity Scholarship Program that's suitable for families and who qualify based on household income. And the other one is called the Educational Student Accounts ESA Plus program that's suitable for students who qualify for special education services through the school district. And if families qualify for both and you like to look into additional options from the public school system, this is a place that you can start. And if you have additional questions about how to get, how to know whether your child qualifies for special education services, don't hesitate to contact us.
Thank you, Nancy. That is true. ECAC has done a lot of work in helping families understand how to obtain the eligibility determination paperwork that is required for these programs. That is the little star there on the bottom. You must have a valid eligibility determination program from the North Carolina public school system in the IEP process before being able to be eligible and apply for these programs. Next, I will tell you a little bit more about the North Carolina Down Syndrome Alliance. Their mission is to empower, connect, and support the lifespan of individuals who have Down syndrome, their families, and the community through outreach, advocacy, and education in North Carolina. Something that is really useful and helpful that they do for the community is their NC First Call program for new and expectant parents. They provide prenatal information packets or a welcome baby bag that contains gifts and resources. So they really like to get involved and work with families through starting at birth or even before the baby is born to help them have the information and resources that they need from the start. They have an award-winning new parent handbook, a parent mentor program to connect with other parents who may be on similar journeys, and then they can even provide hospital and in-home visits upon request. Their learning program is a 10-month program that uses effective research-based teaching strategies and customized materials to support families of children with Down syndrome during their educational process. So here we have the employment and independence for people with disabilities. I should have capitalized that P, and I'm sorry for that. I will say a funny thing that happened here today is, as many of us might know, this used to be called the Division of Services for Vocational Rehabilitation, or DVRS. I was updating a former version of this presentation and had to change that acronym there. And I was reading along as I just deleted the DVRS and inserted the EIPD. Luckily, I was fortunate enough to have reread the statement that I was editing, because I changed it from the Division of Vocational Rehabilitation Services helps people with disabilities achieve their goals for employment and independence, to a sentence that read, the Division of Employment and Independence for people with disabilities helps people with disabilities achieve their goals for employment and independence. So as you can see, the name really does fit, and it says precisely what they're there to do. This is a state program that helps people who may have physical, sensory, mental, emotional, and learning disabilities find, get, or keep a job. EIPD tailors services to the needs of the individual, and services can include career counseling, education and training, job placement assistance, and ongoing support. Medical treatments and assistive technology may be provided as well. And next we are moving on to the Special Olympics of North Carolina. So this is a year-round sports training and athletic competition that provides a variety of Olympic type sports for children and adults with intellectual disabilities, giving them continuing opportunities to develop in physical fitness, demonstrate their courage, and experience joy while participating in a sharing of gifts, skills, and friendships with other families, other Special Olympics athletes, and the community. Special Olympics aims to combine high-quality sports with a wide audience and be a driving force for social inclusion of people with disabilities. And their services are offered to those who are age 8 and up for any ability level, and it is free to participate, which means that the cost of equipment, uniform, travel, etc. will all be covered by Special Olympics and not out of pocket to families. Many of us may know about the Social Security Income, or SSI. SSI provides monthly payments to adults and children with a disability or blindness who have income and resources below specific financial requirements. We all know that this process can be somewhat difficult to navigate. So ECAC does provide resources around navigating this process, as well as individualized support. If you know of anybody that needs more information on this process, or really just doesn't know where to begin, that's something that we would be happy to assist with. And then I would like to pass the mic to Nancy so she can tell us a little bit more about the TEACH program.
Thank you, Brittany. I'm going to tell you about the Teach Autism program. That it's a well-known program. It is a university-based system of community that has regional presence. It offers a set of core services along with unique demonstration programs, meeting the clinical, training, and research needs of individuals with autism spectrum disorder, their families, and professionals across the state of North Carolina. In particular, clinical services include initial referral and consultation, diagnostic evaluations. So for instance, if you are wondering whether your child might have a diagnosis of autism, this is a great place to start and find out with a diagnostic evaluation. And it is my understanding that you can go through the route of a physician, a pediatrician, a provider, or you can yourself as a parent self-refer your child. They also offer family consultation sessions, parent support groups, social play and recreation groups, individual counseling, employment services, and consultation for teachers, residential care providers, and other professionals. So it's a very important resource. Next, please. Next one is United Healthcare Children's Foundation. This is a foundation that provides medical grants to help children birth to 16 gain access to health-related services not covered or not fully covered, by their family's commercial health insurance plan. So in other words, when there are many situations where Medicaid or private insurance will not cover medical equipment, this could be a good resource for you to look if you can get that covered through this foundation. Next, the next one is a favorite. It is talking about our family-to-family health information center, and that I hope many of you are aware, but if you are not, abbreviated as F2F. F2F is a health information center where you can find resources such as this ones. We overlap a lot with the resources we are providing today. You can also find many of these resources for the community of families that have children with special healthcare needs. That includes deafblind families, of course. And so if you have any questions, please don't hesitate to contact us. And in particular, Christy Moore, who is the lead for the program. And here's more information about it. Thank you, Brittany. So if you have an inquiry, again, don't hesitate to contact Kristen Moore, and this is her email address. And individual assistance is available in English and Spanish, very important, and other languages upon request. And next one is where to find this ECAC DeafBlind resources. We have a nice link that you can read at your own pace later. We also have a YouTube channel where you can look some of our webinars that we have recorded. We have some resources from the Department of Public Instruction, and in particular one for DeafBlind, which is DPI Canvas Hub, which has resources for families and professionals. So please check it out. And East Carolina University Teacher Support Program. And this is the link to find more about them, which is one of the partners of the North Carolina DeafBlind project. And with that, I pass it back to Brittany.
Wonderful. Thank you so much, Nancy, for all of those wonderful resources. So, because we are a federally funded organization, our funders really do like to know how we're doing. So, if you wouldn't mind to just take the next couple of minutes to fill out this survey for us, and just let us know if you feel that our resources have been helpful to you. Let's see. Nancy, could you launch the evaluation, please?
Yes.
Thank you. And then we don't have too much time, but if there are any questions that Nancy and I can help with, we will go ahead and stop the recording. And if you could post any questions you may have in the Q&A, please.
Can you see the poll, Brittany?
Yes, I can.
Okay, just making sure. And just going through the chat. No, thank you for all being here, getting a little